I'm here at Parkland Ambulance with Lyle to find out how we can better prevent COVID-19. So can you give us some tips on what we should be doing?
Well, you're going to hear the message really loud and clear from many people, whether you're on social media, turning on your television, hearing from your neighbors. Please, we need to be prepared. Don't take this lightly. Don't think it's not going to happen to you. The thing that we want to emphasize to people right now is, in fact, the social distancing. So we're already seeing where restaurants maybe had seating in a drive-through, now they're only going to drive-throughs. We've seen our schools close. Some businesses are already reducing hours and certainly asking staff to work from home. We need you to stay at home. We don't need you outside in the community running around. I know that people want to get groceries and, do things, but for now, let's get you home. Let's get people healthy so we can lessen the impact of COVID-19. It's not that it's going to come, it's when it's going to come to affect our community. So things like, you're hearing the message, wash your hands. We were talking off camera already about, even our paramedics, how bad their hands are getting simply from the fact of they're washing and sanitizing so much. I know that right now within our community, hand sanitizer is like kind of gold. I'm kind of holding one of these gold things up, and no, you can't take it home, Lataevia. But it is tough to buy. But often people think that they need, I need a Lysol wipe, I need a hand sanitizer because that's the best. It's about convenience. Having these things is great because it's convenience. I've got it in my purse, my pocket. But good old-fashioned soap and water are the best solution for you. If you're concerned about what to do, you think that, I have maybe a fever or I have a runny nose, but I haven't traveled and I'm not sure, should I go to see my doctor? Let's try to do some things at home first. What can I do at home to look after myself? What supports do I have? So people should start thinking, if they haven't already, because maybe kids are home from school, obviously, but from daycare, those things, what supports do I have? So have those conversations, because if you have to self-isolate, I'll use myself as an example. If I have to self-isolate from the rest of my family, that means they're going to be in one part of the home and they can't have contact with me. So I want them to be safe. I need to know that if I'm the person that goes for groceries, who's going to go get the groceries? So start to have these conversations now. In the inevitable thing that it maybe happens to you, you can call on a neighbor, your sister, your brother, maybe friends at work who can bring something for you. Or maybe you have another part of the house, like we have an upstairs and a downstairs, because you got to remember that's 14 days of self-isolation. We've got to keep ourselves safe. We have no vaccines. We have limited treatments. Let's help our healthcare professionals out by staying away from doctors' offices, clinics. I'm not saying don't go to your doctor. By all means, I'm not saying that. But rather than go with the sniffles and sit with the rest of the people in the waiting room with the sniffles, what can I do at home? What resources do I have? Sask Health has some great resources, the government of Saskatchewan Health Authority. We have some great self-assessment tools. We know that 811 is working to improve as time goes by. Be patient, folks. This is a worldwide problem. It's not just Saskatchewan's problem. It's everyone's problem. Please do your part to cover your cough, wash your hands, stay home if you're sick, keep your family, your friends, even your pets healthy.
Of course, and I think that's one thing that we don't really take into consideration is when you're self-isolating, you need to separate yourself from the rest of the family. Thank you so much, Lyle, for your time and for those tips. Like Lyle said, there's so much going on around the world right now, but the best thing is that we're banding together as a community. If you need any more information on COVID-19, make sure you tune in to CTV News.